All right, we're gonna do the soft tissues of the shoulder. So I'm first gonna have my deltoid. So I have my anterior deltoid here, my middle deltoid, and then my posterior deltoid. All of those are gonna be for a strain with a T. Then I also have my pec major, and that also would be for a strain with a T. We have the bicep brachii long head. That's gonna go right up here through that bicipital groove, and that's gonna be for a bicep tendinopathy. If I go lower and I have the patient supinate and resist me, I can feel the bicep right here, and that's the bicep brachii. And then I can also, on the lateral side, feel the brachialis. And the brachialis and the bicep are both for a bicep strain or a brachialis strain. Then we are also going to have the subacromial bursa. So if I find the AC joint and then I go just lateral to that, it's right on the tip of the shoulder, that's going to be the subacromial bursa. You're looking at that for like a bursitis or for an impingement syndrome. And then you are also going to have your AC and your SC ligaments. So on the outside at where my AC joint is, I have a ligament there that could be sprained with a P. And then if I go to that center where that meets the sternum, that's going to be a SC sprain with a P. Then I get on my patient turnaround. We are going to have our posterior deltoid, which is right here on the back. That's for a strain with a T. You have your serratus anterior. So your serratus anterior are kind of like finger muscles that go right here. So you go from the back right here and go to the front, right about that ribcage area. That's going to be a strain with a T. Your teres major and minor. So your minor is at the bottom of your scapula and it attaches to the humerus here, and then the major is just below that. So like at the bottom of the scapula and then a little bit more laterally. And those are both going to be strained with a T. And then we also have our rhomboids. Our rhomboids go from the T-spine to our scapula. So they're right here in this area. And those rhomboids are going to be for a strain with a T. You have your latissimus dorsi, which is the big muscle here. So you can palpate this whole area across the back and down this area because it's kind of that whole lat in the lower back. That's going to be a strain with a T. We have our trapezius. Our trapezius is going to go from the head to the lateral shoulders and then back down again. So you're going to go here to the side and then to the middle. And your trapezius is all for a strain with a T. And then you are also going to have your supraspinatus, which if you find your spine of your scapula, your supraspinatus is right on top of that for a strain with a T. And then right below is the infraspinatus, and that again is for a strain with a T. And then lastly, we have our triceps, which are on the back of our arm. We could have our patient extend their elbow, and you can feel the triceps right there, and that's for a strain with a T. Thanks.